The Extensive Care Center is a new concept for Central Ohio. This is a site that allows us to bring patients in who might require further medical care or a longer patient visit than their primary care doctor's office. We're able to provide quality care for this patient in a setting that's a little more personal and comfortable than an emergency department.
The problem is there are a significant number of stable patients that come to the emergency room that could be treated in the outpatient setting. If we can actually divert a lot of those patients to this clinic to prevent the patients from the exposure in the emergency room and in the hospital in general is going to be a very big deal.
The two types of patients that the Extensive Care Center will serve will be patients with acute conditions that might have been taken care of in an emergency department or an urgent care in the past, and patients that have chronic medical conditions that are complex that might need an extended level of care via an hour or two visit with a physician and a nurse.
The gap in care we're trying to fill here is patients who appropriately need longer monitoring that can be provided in the outpatient office, or certain medications, IV Lasix, IV antibiotics, that typically are only available in the hospital, but the patient's otherwise well enough that they don't need to be hospitalized. The ECC helps address this issue by providing these higher levels of service, but in the outpatient environment.
If you're seeing or talking with or caring for your patient, and you would think of sending them to the emergency department, or you think that they have a condition that might need to go to the emergency department or an OBS unit, we would ask that you call the Extensive Care Center, talk to the physician or nurse directly, find out if the patient you have is appropriate for the Extensive Care Center and how we can best serve them in the Extensive Care Center.
One of the best things I've found working with COPC is the feeling of family and the ability to take care of patients and have immediate contact with their primary care physician. Everything we would need to provide the best care for the patient during hospitalization, at the family care office, at the Extensive Care Center.